found yourself hyper-focused or fixated on a body sensation? Maybe your breathing, your heart rate, swallowing, tinnitus, or even blinking? Well, you're not alone. In today's video, I'm going to dive into sensorimotor obsessions, or somatic awareness OCD, and share my own struggle and strategies that help me. Many people that struggle with this have no idea that it's a form of OCD. Stick around because understanding this might just be the key to help you recover as well. Welcome back to session. I'm Paige Pradko, a practicing anxiety and OCD specialist. You might be wondering, what is sensorimotor or somatic awareness OCD? People with somatic awareness or sensorimotor OCD become hyper-focused or hyper-aware of automatic bodily processes or sensations. Imagine trying to get to sleep and you find yourself manually controlling your breathing or uncontrollably counting your breaths, unable to stop. It's maddening and it feels like you might stop breathing altogether without your constant awareness. Now, I didn't even know it had a name until I was trained as an OCD specialist. For me, the trigger was breathing when I was trying to fall asleep. And I would manually control every breath, fearing that my breathing would not become unconscious again, and that I wouldn't be able to get to sleep. And it was so frustrating. It just became my personal nightmare. Now, the fear for most people with this type of OCD is that the awareness or the hyperfocus itself will never stop. Somatic awareness can include unwanted attention to things like breathing, swallowing, blinking, having an awareness of the movement of the mouth or tongue, eye contact, visual distractions like eye floaters, your heartbeat, tinnitus, even the feeling of a full bladder, or the awareness of specific body parts like seeing the side of your nose or feeling your fingers or your feet. But unlike more known themes in OCD, sensory obsessions rarely involve fears of harms to yourself or to the others. Although I have seen that in my practice where a body movement like blinking was done in a certain way to prevent something bad from happening. But mostly the fear is related to the awareness never ending. Now, the fear can also take different forms, like worrying that others might notice, or fearing a loss of control or going crazy, or, as in my case, the fear of not being able to get to sleep due to this relentless focus on my breathing. Now, the compulsions often involve attempts to control the bodily process, or manually checking or monitoring it, doing them in a certain way, like swallowing in a certain way, counting, maybe counting breaths, seeking reassurance from others, or ruminating, attempting to distract oneself. Now, these obsessions and compulsions can cause significant distress and suffering in daily living. So how do we treat sensorimotor obsessions? Well, like any anxiety or OCD condition, once anxiety is experienced and it becomes associated or connected with something, it becomes linked. And in this case, anxiety becomes linked in the brain with awareness of a bodily sensation or automatic body process. When anxiety becomes linked with that body sensation, thought, or urge, the unconscious mind keeps it ever present in your awareness. In as much the same way as, don't think of a pink elephant example keeps you thinking of a pink elephant. Now, the first step is an education process and learning that the body sensation itself is not harmful or dangerous. Next, to undo that link of anxiety in the brain, the body sensation must be experienced with a relaxed, welcoming, and accepting posture and attitude. Now, this is a form of ERP, exposure and response prevention. Next, there are a variety of ways to practice ERP, and this can create some confusion. So you might be wondering whether to try to have this sensation on purpose or not. So let me explain. You may plan exposures where you purposefully have this sensation. You focus on the sensation, and that is the exposure part. And the response prevention includes not engaging in any of the compulsions like trying to control or stop the awareness. Now, according to Dr. David Kuehler, a clinician at the Behavior Therapy Center of Greater Washington, repeated voluntary exposure to the sensations leads to diminished anxiety as patients grow accustomed to embracing any awareness without attempts to avoid it or escape it. Another treatment option is to practice ERP in the moment when the somatic awareness or hyper focus happens in real life versus planning the exposure. As an OCD specialist and a person with sensorimotor somatic awareness OCD, myself, I've developed the IM technique. Now, this is the technique that helped me to recover. IM stands for identify, allow, and shift your focus in the moment. Now, let's dive deeper into this incidental ERP technique. Identifying the awareness of the sensation is a diffusion technique from ACT therapy, and it seems to happen automatically for most of us. But just saying something like awareness really clues your brain that you are aware of the sensation. Next, allowing the awareness, the thought, the urge, the sensation, that's the most crucial part. It involves accepting it without attempting to push it away. I would even talk to my somatic awareness if it popped up, and I would welcome it to stay or go or whatever it wanted to do in a very calm and accepting way. Now, next, shifting your focus in the moment involves moving your selective attention to something else on purpose. Now, this is not distraction because you're not trying to not have the awareness. You're allowing the awareness to be there, to kind of float there in the back of your mind while you're intentionally shifting your focus to something else. So it's like you're holding a flashlight in a dark room. So first you focus the flashlight, you point it at the chair, and then you shift and you point it at the table. Now you know the chair is still there, you're just not pointing that flashlight at it at the moment. Now with practice, your sensation or awareness of an automatic body process will no longer be associated with anxiety, and your brain will not be compelled to keep it in your constant awareness. Any sensation will be better tolerated and the anxiety will eventually fade. Now, a third recommendation of treatment is practicing a technique called a body scan, where you shift your awareness, the awareness fluidity from one area of your body to another. According to Dr. Kuehler, patients are instructed to close their eyes and selectively attend to their feet, for example, until they acquire full sensory awareness. Once this occurs, they can next move to their calves, stomach, maybe upper body, arms, head, or any particular sensorimotor process like breathing. Now, patients learn that they can move gently from one sensation to another without getting stuck by refocusing in the absence of anxiety. Over time, patients begin to experience a fading of sensory awareness, a better tolerance of it, and their anxiety diminishes as their willingness to invite in the sensations grow. Now, whether you choose a more traditional ERP or an incidental ERP approach like my IM method, or a mindfulness approach like a body scan, the key is to invite in the sensations with an attitude of welcoming and acceptance without anxiety. Now, if you found this information helpful, I offer in-depth courses on OCD and health anxiety. Now, people with sensorimotor obsessions commonly also experience health anxiety OCD. These courses integrate various techniques, including those discussed today. Now, for more personalized guidance, please visit PaigePradko.com and check out the description below. Forms and links and resources are left there. Now, until next time, I'll see you in session. Take care. Bye-bye.